Hi, this is Kevin with Reinvent Dental Products, and we're going to take a brief look here today at the NiTin Sectional Matrix System from Reinvent. It's Reinvent's first product offering. It's got some very unique features. Of course, sectional matrix for getting a nice tight contact on Class 2 composites. And we'll review the components in the system. We'll take a quick look at doing a couple restorations on a Type-A-Knot. And as we go through, we'll be able to talk about the various features and benefits of NiTin. First of all, let's go ahead and pop this brand new kit open and take a look at what's on the inside here. This is what I would call a standard kit. There are various kit configurations available depending upon where you are in the world. Some have more components or less components depending on location. So there are 5 sizes of the sectional matrix bands, the 4 sizes of the plastic wedges, and then there are the 2 separator rings. The first one I pulled out of the box here is the shortest band. You might consider that a bicuspid or premolar, short molar, even pedodontic applications. The second one here is the same gingival occlusal height, but with a subgingival apron for slightly deeper restorations. There's a mid-size matrix band. There is the, full size, largest size of the molar band. And then there is the molar band with a subgingival extension, again for those deep restorations. You can see how they are nicely formed in 3 dimensions. They are curved gingivally occlusal, buccal lingual, and they are nice and long so that you get a nice wrap around the tooth. That aids in ring placement. There is a placement tab on top of the band, and the kit comes with, again, depending on where you are in the world, it will come with one of these tissue forceps, which are excellent, great grip on them for placing and removing the matrix bands as well as the wedges. So 5 sizes of matrix bands. Now when you're selecting a matrix band to use, you want to closely approximate the height of the tooth with the band. You don't want a band that's too tall or too short. If it's too short, you may fill over top of the marginal edge, marginal ridge a little bit of the band, and subsequently make it very difficult to remove. Your curvature interproximally will be a little bulbous as well. So if it's too tall, your tendency is going to be to overfill that restoration and have to trim all of that material back. And then also your interproximal curvature will be a little bit flat. So try to match the height of the band to the height of the marginal ridge of the tooth. These are the NiTin wedges. They're a firm plastic wedge, very anatomically shaped. They have just all curves and soft edges so that as you're inserting the wedge, you don't tear up the papilla, or if you've got a rubber dam in place, you're not tearing up the rubber dam. You can see how it's got a ski-like tip, so that slides up and over the papilla without causing damage. It's probably a little difficult to see here in this video, but the underside has a little bit of concavity to it, again to allow some extra room for the papilla. And then you can see the edges here, these edges that would be up against the gingiva as you're inserting it are nice rounded smooth edges, so they don't cause additional trauma. The sides of the wedge are anatomically shaped to help alleviate flat spots in the bottom of the box of your restoration. So really nice wedge, nice and long. That's very beneficial when you're using a sectional matrix system to have a nice long wedge like that, so that you can be sure to penetrate all the way through the interproximal area and seal all the way across. So very nice feature there. So of course the stars of the show are the 2 NiTin rings. Now The difference in color denotes the length of the tips. The black tipped ring is longer than the white tipped ring. And the purpose of the two different tip lengths is to allow for easier stacking of the rings, one over top of the other, when doing a MOD or a multiple tooth restoration like I'm going to show you here in just a minute. So as you can see, the underside of the ring has a substantial channel in it to fit over the wedge, so that placement of the ring is more simplistic. And then this is a unique feature, the way that these tip shapes are made so that they grip down below the infrabulge of the tooth. What that facilitates is a very strong grip on the tooth to prevent the ring from accidentally becoming dislodged. That is one of the key things about the new NiTin system, is how well it grips on the tooth. Really holds in there nicely. The materials used here, the plastic material here is a material called PEEK, P-E-E-K, and it is a very high strength plastic that retains its shape. It's very chemically resistant and heat resistant. It's not affected by autoclaves or other sterilization methods. So it is very durable. The metal that is used in the ring itself, the metal extends into the tip and then wraps, of course, all the way around the back of the ring. And this metal is a drawn wire nitinol, nickel titanium. And the drawn wire process creates molecular alignment within the metal and greatly increases its resiliency over the long term compared to other methods of manufacturing nickel titanium rings. There are several other nickel titanium rings on the market. They are not produced the same way, and this allows, our production method allows for a ring that is substantially longer lasting than the other nickel titanium rings on the market. With the addition of the PEEK reinforcing backer, we are able to significantly increase the separating pressure, not just the longevity, but the separating pressure generated by this ring when it is brand new versus when it has been used 300 times. That separating pressure remains at an optimal level, so that you get tight contacts, whether it's the first time you're using the product or the 300th use of that ring. So these are the different components. Let's take a quick look at what it looks like on a Typinot. What I'm going to do is these two MOs, so that we're stacking the two rings. I think that's a great easy demonstration so that you get an idea of how well the rings stack. We've got the canine bicuspid situation here, which will demonstrate for you how well the ring sticks on the tooth. That is a difficult place for most sectional matrix rings. Some rings on the market, you would be hard pressed to have that ring stay in place between the bicuspid and the premolar, and we'll see here that the NiTin ring hangs in there very nicely. So for these teeth, what I'm going to do is grab two of the bicuspid premolar size bands. Sometimes the bands, because of the way they're shaped, they'll have a tendency to kind of stick together a little bit. So see, that looked like one, it turned out to be three. So dropping them on your tray is a good way to ensure that you've separated those bands so that you're only using one. That first of all, save you some money, and second of all, the additional thickness created by having more than one band in place at a time will impede your ability to get a good contact. So I'm going to go ahead and slide that band in, and grab another one. Use that little placement tab, slide that band in. Sometimes it's helpful, I'll give you a little tip here, because of the curvature on the band itself. If you try to press it down interproximally, just driving it straight down, sometimes that gingival edge will catch the edge of the prep and cause it to hang up. So if you use a little bit of a curving it around the tooth motion like that, that can really help you place that band without hanging up. So this is pretty wide open, so it's obviously a lot easier for me to do that. I'm going to grab a couple of wedges. You'll find typically that you'll be using either a blue or an orange wedge most of the time. I think that's just the nature of average dentition, that this fits nicely in the interproximal space. Every once in a while you'll need to go to the big green wedge, and then if it's really tight, you'll use that little yellow wedge. So I'm going to see here how the orange wedge fits. It's very beneficial, in fact almost mandatory, to hold a finger on top of the band as you're placing the wedge. Otherwise the wedge will drive the band out. In fact, I'll show you here. See how it displaces that band as I'm inserting the wedge? Put a finger on it. Make sure the band is held down against the gingiva, and then apply your wedge, and it's not going to move. I'm going to do the same here. There we go. Now, the order that you're going to place the rings in is you're going to place the mesial ring first, the short ring first. So the ring placement forceps come with the kit. They're designed to hold those rings very securely. I would not recommend use of a rubber dam clamp forceps. That makes it very difficult to control the ring during placement. And then I'm going to come in and put that right in place. I can come over top of that with the longer ring, just like that. So once you have the rings in place, one of the last steps is take some sort of an instrument like this, come in here, make sure that that matrix band is firmly in contact with the adjacent tooth. I'm not burnishing it aggressively. That will put lines in the band and subsequently lines in your restoration. All you want to do is make sure it's tugged over nice and tight. With the amount of separation generated by these rings, this little tug is all that's necessary to make sure that you get a really tight contact. It's a good idea once everything is in place is maybe take an Explorer or a thin bladed instrument and just look down in there with your mirror and your loops and make sure that the bottom of the box is nicely sealed before you start your etch and bond. So once you have completed the restoration itself, you are going to reverse the steps. Just start off, remove the rings, pull out the wedges, and if the band is in there very tightly, just grab the edges, peel them back, make sure that there's no adhesion of the adhesive to the band, and then either grab it by the tab or get a nice big bite on the side and lift it up and out. So there you have it, the NiTin sectional matrix system from Reinvent Dental Products.